I'm going to talk a little bit about receptionists in waiting rooms. And before I start, I thought I'd just introduce myself. So just a little about who I am. Well, I'm what's called a kaupapa Māori medical officer. So you might not know what that is. That's a doctor who's working within a Māori organisation. In particular, I work for an iwi organisation. And I'm not really a GP, although I do GP stuff. A lot of the stuff that I do is relating to working within a Māori model of health. I do a lot of health promotion and empowerment type of work, and do a lot of policy stuff, and I advocate quite strongly for people. My other role is I'm a senior lecturer at Auckland University, and I'm sitting in the Department of General Practice and Primary Healthcare. I'm also a PhD student, and I'm studying the quality of Māori health providers for my PhD topic. But I guess most importantly, I'm a father and a husband. And in the picture, you can see my oldest son. That picture was taken a couple of years ago when we tramped up, Haui. And I think what's important, we all have various roles as doctors or nurses or receptionists, or a lot of you are practice managers. And we are also patients as well. And we're people with interests and we have complex backgrounds. And I think this latter thing is really important when we think about how we engage with others in a health environment, just thinking about the complexity of the people that are in front of us and who we are. So just a little bit more about myself. I come from Northland. I come from a small little place called Waima. Waima is in the South Hokianga. I grew up there as a child. And I don't know whether you can guess which one I am. You probably can guess which one I am. I think it's really important to kind of like think about where you're from. Where you come from shapes who you are. And the importance of this is in something called whakawhanaungatanga, which is the development of relationships. And I think if there's one thing that you take away from my talk today, and that's about how relationships are so critical to how we engage with people. So if you haven't already guessed which one I am, that's me there. So I was the little white boy right in the middle. My mum was the school teacher, and we were the only Pākehā family in the community. A couple of months ago, actually it was probably about 4 months ago, I had this family come in to see me, and it was a mother. She was about in her 20s, and she had a small child, and she brought in her mother as well, her older mother. And as I said, I do something called whakawhanaungatanga, which is I try and develop a relationship and connection with people. And because my family have been in Northland since the 1850s, and we seem to be related to most of the people or have connections with people from where we've kind of been brought up and where my family's from, I find it quite easy to make relationships or connections with people, which is what whakawhanaungatanga is. Anyway, I was talking to her and she said she was from Waima. I said, well, what a coincidence, I'm from Waima as well. And she said, I asked her what her surname was, and she asked me what my surname was, and she said, oh, I remember you. You're the little white boy whose nappies I changed. And that's her there. So making connections, I think, is so important. I'm talking today about my study around waiting rooms. A number of years ago, I started a master's in public health. And part of the reason I started it was kind of what I witnessed when I was a GP. I witnessed this lack of connection in the waiting room. People often asked about debt in front of other people. There was private information that was shared with the receptionist. And all these things made me think, gosh, there's so many barriers. I can see why people don't come in to see me as a GP. One of the things in the public discourse is about how receptionists are often portrayed as being rude, and I don't really think that receptionists are rude, but often there's this discourse that comes through. They're often referred to as dragons at the gate. These people who kind of like put up all these barriers for patients coming in. And waiting rooms portrayed as being these lonely places. This character you see here in the picture is Dr. Zeus. And this was from his autobiographical book, You're Only Old Once. And in it, he talks about waiting in the waiting room and being this lonely old man sitting in the waiting room with only poor Norwal, the fish, for company. And how many times do we see that in our waiting rooms, that we see some very disengaged people or lonely people sitting there with not much social interaction going on? There's something else in kind of like, you know, this whole concept of receptionists has been quite unhelpful. Is portrayed in this this little clip that I've got on the show for you. Hopefully the sound's going to come through. It's Little Britain, USA. And for those of you who have seen Little Britain, USA, there's a particularly unhelpful receptionist, and her name is Carol Beer. And she always says, the computer says no.
Britain has had rude and unhelpful receptionists for thousands of years. Carol Beer exemplifies this fine tradition. Hello. Hello.
Welcome to St John's Hospital. My name is Carol. How can I help you?
We need to go straight to the maternity ward.
Right, admissions. Name?
Helen Fisher.
You don't look like a Helen.
No, I'm Helen Fisher.
I'm Graham Fisher.
Your brother and sister?
No, we're married. My wife's about to have a baby.
It says no.
What?
Baby's not due yet. I got you down for next week.
So that's what is out in the media. You know, it's a very unhelpful receptionist. But my experience is not only just with you know, what I've seen, but also what I've experienced as well. This is a picture of my daughter Ariel. A couple of months ago, Ariel was doing some flip-flops on the beach, and she fractured her ankle. So I rushed her into the emergency department, and I went to the receptionist, and I stood there for probably about 2 minutes waiting, and the receptionist was busy looking at her computer and then turned away. She didn't acknowledge me at all. And it was such a disempowering experience. It was terrible. So all these things that I've talked about, these are the things that I wanted to kind of explore the process of the waiting room and reception process from the perspective of patients. So what I did was I did this study in which I talked to 13 patients. I interviewed them, and I interviewed people who, in quotation marks, were deemed to be marginalized or vulnerable. So the literature talks about those people who have the most barriers in engaging with receptionists as being mothers of young children, youth, people with mental health problems, and ethnic minorities. So I got a range of people and recruited them and asked them to draw what their experience was like of waiting in a waiting room and engaging with the receptionist. And what we did together was we analysed their pictures together. So they analysed their own pictures, and I analysed their pictures at the same time. We came to some sort of agreement about what the pictures meant. So what I'm going to do is I'm just going to run through very briefly what the results of this study were. And then at the end of my talk, I'm going to just kind of summarise some of the tips that came through from the study. So the first theme that really came through was people didn't feel at home or welcome when they came into the reception. So this person here drew a picture of a receptionist, and this was her idealized receptionist, but she analyzed that picture, and she really kind of thought about it a lot and thought that receptionist waiting behind the desk for me is so much of a barrier. And she really thought how that desk was preventing that receptionist from engaging with her. So she ended up drawing in the receptionist's legs after she'd finished the drawing to kind of like demonstrate that she wanted receptionists to be people that didn't sit behind the desk but were able to get out and engage with people. She wanted a receptionist that wasn't going to criticize her or to judge her in any way. And this whole idea of being judged came through very strongly by the people that I interviewed. So this participant here talked about being judged. So he's sitting in the waiting room with his kids, and he's saying, we've been sitting in there, they're playing with things, having a crack-up time, laughing and carrying on. and then a little bit of fighting, like normal. And then you get a sort of an evil eye, and then like, hey, you kids, but noisy, it's too noisy. And if the kids and they're crying and you're trying to keep them quiet, and the people look at you and the receptionist will look up, and then you're like, uh-oh. So he was really saying how this receptionist was just judging him and his kids in some way. And he went on later on in an interview to talk about this sense of being judged. And he had quite long hair. It was he was had dreadlocks, and he talked about how other people in the waiting room judged him as well. And he's talking about coming into the waiting room, but you do get apprehensive. I don't know why. You worry about what other people think, but you get in there and people are looking at you. And I'm pretty used to people looking at me because I look a bit different with my hair and stuff. And this is his picture. So this is his idealized waiting room. On the top right, you see some musical notes. So he really wanted a place in which people could go and chill out and listen to music and watch TV. And in the top middle is a picture of some kids. So he's wanting kind of like a kids-friendly place. And then on the bottom right, some windows. He wanted lots of light. And he wanted the nurses to come out in the waiting room. So on the top left is nurses coming out and just checking on the kids in the waiting room. And he drew this big circle in the middle and asked them, what on earth is that circle? And he originally had envisaged it as being kind of like a hub where people can go to. But then he kind of like critiqued it a little bit more. And he said, that's the evil eye. So that was the evil eye of the receptionist, kind of gazing and watching at him. So there's this whole idea of how people are kind of watched in waiting rooms, and it becomes quite disempowering for people. Here's another quote by Tiffany. Mostly you don't want people to see you. You want to be invisible. And Tiffany had a mental health disorder. When you're really unwell, most people isolate. So being in a room with strangers that you can't get out of, that to her was just terrible. I had another patient who talked about kind of being locked away and the reception being a place of being kind of like barriers. So on the left is this picture, that's her, that rectangle, the green rectangle, and the squiggly lines are her being in turmoil. And on the right is the reception and the waiting room. And originally she drew the grid lines to indicate kind of order. But then she thought that was kind of like a bit like a jail really, and it kind of made her flash back to her background of being in the mental health unit and being locked up, and she kind of linked waiting rooms to this whole idea of being contained and a difficult place to escape from. So Lauren talked about the sense of order and constriction that goes on. It's just dark and doomy, and you think of suits and ties and all by the book, and you know, you're just not a person. It doesn't feel warm and welcoming. You know, waiting rooms need to be warm and welcoming places. They're meant to be places that can break down the barriers for people. People want a family environment. I don't know if it's not like a family environment, I suppose. You want that environment we're going into to be warm, a home of sorts, because most of the time you're looking for a caring environment and a warm environment. And when you go in there, there's brick walls and cold plastic seats all in exact lines. Sit here, the toys are stacked up perfectly. Can I play with them? Don't mess up the magazines. They're all stacked up in a nice pattern. It just feels like 4 walls. Another patient talked about these 4 walls, and he linked it to being in a lift. He talked about how he was the different one, the odd one in the waiting room. He was Māori and everyone else was not. And he thought that people were staring at him and just kind of like judging him. And he talked about how it was being in a waiting room is like being in a lift. You're waiting for your number to come up. Bing. So the other theme that came through was about how people wanted to, or felt this need to conform to being a patient. That kind of like took their personalities away. They were supposed to act in a certain manner and way. So one person talked about notices on the wall. So there was this little notice on the wall of her waiting room, and it said, "Please control your children, other patients are present." Another patient talked about how there was a very important notice at her waiting room, and it said, "Only one problem at a time." And she had so many problems, she didn't know what to do. Oh, there's all these posters in waiting rooms. I don't know, I'm sure that all your guys' waiting rooms have posters, because most waiting rooms have posters, but my patients didn't really like posters. They found them not really easy to look at. Tiffany said, you see all these kids walking home from school with all the wrong things. Obviously, they're not looking at the posters. And the posters for many people are kind of quite confronting. So, yeah, they're not very nice to sit in the waiting room and look at the posters. Some of them are a bit horrific, and they can turn people off. On the other hand, for some people, the posters were kind of like reminders that they were supposed to kind of like act in a certain way. They felt that they needed to look at the posters to know what to do as a patient. They were kind of like had to act in a certain way. And there was all this conformity that kind of went on with waiting rooms. I thought this was quite an interesting picture. It might be hard to see, but you've got the two plump receptionists, and that the participant drew them as being plump. She wanted receptionists who were maternal. And then she drew this very dark figure in the back. I asked what the line was in the figure's hand. He's got this very sinister character with a bit of a black hat and this black line. And this was a whip, she said, and it was he was the doctor, and he was coming out and he's whipping people along to get them in, to come in to see him. So I thought this picture kind of summarized this particular theme, that waiting rooms were like this dressing room. It was like being in a play, and people were rehearsing their lines before they went in to see the doctor. And they had all these posters and notices on the wall to tell them how to conform. So the other theme that came through was the kind of like this ideal waiting room, this home-like place that people really wanted. This picture describes this home-like place. So the golden dots are the patient, and she's entering into this welcoming green environment, and that's the practice. And the blue kind of pool-like thing is a tranquil receptionist who's very welcoming, and the arms are coming out trying to envelop her, and she's coming in, but she's also exiting, and as she exits she's taking her warmth with her because she's been empowered by the practice. And I thought it was very interesting what she put in the bottom right hand corner. I normally ask people what they think that is, but it's a little bit hard. Actually, you can unmute yourself. If anyone knows what that is, they can unmute themselves and tell me what they think it is. No takers? Okay, it's a spirit level. And for her, that spirit level meant that she could only enter the practice when her spirit, her mental health was good. So the rest of the time, she kind of had to be staying at home. Patients wanted receptionists who were warm and inviting. And once again, I normally ask people what this picture is. If anyone's got any ideas, they can unmute themselves. It's a scarf. It's a scarf, and he wanted the receptionist to be like Nana. He talked about receptionists being like Nana. They were warm, inviting people who would make him a cup of soup and wrap the scarf around him and cherish him and look after him. People wanted nice couches, sofas that were comfortable with lots of colour, and pillows. They wanted to be kind of really loved. They wanted receptionists to come out from behind the desk. So you can see this picture of a mum and her child holding hands, and the receptionist is the one with the slightly different red dress who's come out from behind the desk, and she's engaging with the child. Now, the interesting thing about this picture was the tuku patterns on the reception desk. Cultural kind of reminders, being responsive, were really important for lots of participants. This kind of like summarizes lots of things. So having receptionists who are warm, a smile, those big red lips, welcoming eyes, which are the flowers, and then this thing with a cross through it, that's the desk. And once again, this person thought that desk was a real barrier, and she put this big blue cross through it to rule out the desk. She just didn't like it once she drew it in. So I'm going to talk a little bit about some tips that really came through from this, and then I'll I'll unmute everyone and we can have a discussion. Matter of fact, I'll see if I can unmute everyone now. No, I can't, not at the moment. Okay, so there were kind of like about 4 things I want to talk about, which my study kind of discovered really. The first thing was about the importance of facilitating social interactions. So how you design your waiting room is really, really important. Having seats that can create kind of speaking or talking spaces so that people can talk and engage with other people in the waiting room was important, rather than a waiting room that was really clinical and people were just in their own little bubbles. But on the other hand, it was important to have some private spaces as well for people who are feeling a little bit unwell. It was really important for patients to have kind of homely things in the waiting room, so sofas and cushions that made people kind of like sit in different ways and kind of like turn their bodies around so they could talk to people. And people wanted to kind of like have some sort of community involvement, patient redesign of the waiting rooms as well. And I can talk a little bit about later on about how we've gone about doing that in our place. I think it was really important to look at your waiting rooms as being kind of like being responsive. So, you know, as I said, having private spaces so people can breastfeed, places that they can go to if they're feeling really sick and not wanting to contaminate people with their coughing. The importance of cultural values. So, like Māori or Pacifica art, use of te reo Māori in the waiting rooms, having child-friendly spaces, youth-friendly spaces, having free Wi-Fi. That was really important as well. Lots of people wanted to have Wi-Fi so they could, you know, connect and look at some health-related things. But I think also in this day and age in which we're trying to get patient portals, and knowing that many of, well, at least my clients can't afford data on their phones, having a space in which they can connect with Wi-Fi might enable them to connect up with patient portals. Otherwise, patient portals are going to be a thing that creates more inequity. Becoming less clinical. I think we need to get waiting rooms away from this whole idea that they're an extension of the clinical space. They're not. They're an extension of the community, and we need to take the clinic out of the waiting room. I think removing medical posters and notices seem to be important. Having light, kind of brightness, windows, furnishings and nice bright colour. Those are all things that seem to attract people into a waiting room. And the final thing really to talk about is this whole idea of being welcomed. And that comes back to what I was talking about in the very beginning of the presentation about engaging with people. And it's all about relationships. And having that receptionist who is a welcoming person, who interacts with people, who kind of has the person on their side. And that is something that's really valued by people. A colleague of mine, Pat Newt, who's done a lot of work on receptionists as well, has talked to receptionists and interviewed them. And the results from her study showed that receptionists really wanted to engage with people, but they were constrained. They were unable to do that because of just the busyness of the clinical stuff they had to do and the fact they had to try and protect the doctors. But receptionists really, really, really wanted to engage more with patients. And I think we have to facilitate that with our receptionists, enable them to engage and interact with people.